Hello again, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me is Dr. Kyle Lemley, who is a pediatric critical care specialist and a pediatrician at Monument Health, the Rapid City Hospital here. Thank you for joining me again, Doctor. I appreciate it.
Thank you.
You bet. We are heading into that time of year. Especially around here, we all start to worry about it a little bit because we have our 90 days of warm weather when we all get to go outside. And then we have the rest of the year where we're indoors around everybody that's not washing their hands and covering their mouths when they get sick, right? So we're heading into what you as a pediatrician refer to as the triple pandemic, which is coming up. Is this because of COVID, obviously? Was before COVID a thing? Was it just a double pandemic with RSV and the flu in children?
Before COVID, when all of the kids were actually out and getting exposed to everything,
right?
We had a spike every year of, obviously kids getting RSV and kids getting the flu and everything. But, and the numbers varied every year and the severity varied, but it wasn't quite as large of a number because kids were exposed to it every year. So the biggest thing last year that made it such a big triple-demic kind of a thing was for the past, since 2020, kids had been masking at home. They weren't out at school and getting exposed. And even when they could go, the parents were scared to get their kids exposed to COVID because, the vaccine hadn't been out yet. And then obviously we don't want to get into who wants to vaccine and who doesn't want a vaccine and all of those kinds of things. But for 2 years, you had all of these kids that hadn't been exposed essentially to RSV and flu. And so then last year was kind of the first year of no masking, everyone all back in school, back in daycares, parents back at work. And so we just saw an outrageous number of RSV, flu, some COVID, and actually other viruses popping up that all can cause this phenomenon called bronchiolitis.
Really quick, before we hit that specific topic that we're going to talk about, we're all familiar with COVID. We're all pretty familiar with flu. I know RSV, unless you have children, really, I don't think you really know what kind of disease that is. Could you just talk about that really quick?
Sure. And I think RSV gets blamed for all of the bronchiolitis, and it's really just one of the viruses that can cause it.
So it is a virus.
It is. Okay. It is just a virus. Respiratory syncytial virus is what it's called. Historically, it can cause really young children, especially premature infants, and especially infants with cardiac disease, really significant issues in their lungs, and they can get really sick and die from it. But that's just the same as adenovirus, rhinovirus, enterovirus, all kinds of things that cause the common flu the common cold can cause bronchiolitis and present in a very similar way. RSV is just better known amongst the general population, and so everyone kind of throws that term out there. But it's just another virus that can cause bronchiolitis.
So before we get too far into that, because I know some people are, I would probably listen to this thinking, he's pronouncing bronchitis wrong. No, they're two distinct things.
Two distinct things.
Bronchiolitis and bronchitis. So can you separate those two really quick as well?
Sure. Bronchitis is more of an adult diagnosis or an even teenager diagnosis. It's in the large airways. You still get secretion production in the airways and those kinds of things, but bronchiolitis is in the small airways. So whenever we talk about airways, we obviously start at the nose and the mouth because that's kind of the start of our airways. And then we go to the windpipe or the trachea. And then the trachea branches to go to the right lung and to the left lung. And then those branch off and provide to the different lobes of the lungs. And then each one of those airways keeps branching and branching and branching until you get down to the small airways called the bronchioles. So the bronchioles are what go to the airway sacs or the alveoli. And so bronchiolitis is just an infection in the really tiny airways in kids, producing a lot of mucus, inflammation, and then they end up getting all of these. We say they sound like a washing machine. So when you listen to them with a stethoscope, You hear all that. And if you listen 5 minutes later, it's going to have a different sound to it. And so they just cough and clear and it moves to a different spot, but they all kind of have this washing machine kind of sound to them. The other main part of the diagnosis to bronchiolitis, because it's what we call a clinical diagnosis, I can't run a test and tell you your kid has bronchiolitis. I can run a test and say your kid has this virus, and that's what caused the bronchiolitis, but the bronchiolitis is a clinical diagnosis. So you have fever, runny nose, congestion, and those breath sounds that we were talking about because of where all of the inflammation is in your lungs.
Well, it seems so hard as a doctor to differentiate. If your kid comes in, now you're looking at flu and the COVID and the RSV, and now having to drill it down to bronchiolitis too. So you can't. All you can do is say you have a virus, but now we've got to go deeper, right, to see what it could be.
And most of the time, I don't care which virus you have.
Okay.
COVID, we still treat a little bit differently. We'll give you some steroids and stuff if you're on oxygen, but we don't quite go as aggressive as we were going early on. With influenza, I want to know if you have influenza because there's Tamiflu and some other antivirals that we can give you if you're in a certain population of a high-risk population. So if you have asthma, if you're a preemie with chronic lung disease, or if you're an infant that has some kind of cardiac disease, kids that have had open heart surgery, especially the younger ones, we would tend to give them Tamiflu sooner than just other kids because trying to shorten that as much as possible or making it as less severe as possible is good. RSV, I don't really have a specific treatment for it as well as any of the other viruses. So a lot of times we'll run a viral test just to make sure it's not flu or COVID. And then if it ends up being RSV, okay, we know what it is. But a lot of times we don't go looking for the host of other viruses that it can be because I can't treat you any differently.
Well, can all three of those lead to bronchiolitis then?
Yeah.
All three of them can.
All three of them can give young infants bronchiolitis that present and look and act exactly the same way.
So I think you would recommend to parents, if they're starting to get these symptoms that you listed, don't wait them out. I mean, make sure you get your child in. Because if it's any of these three and what it can lead to.
I mean, it kind of depends. And so if your infant is or young kid is just having, I guess let's back up.
Okay.
So we think about bronchiolitis in kids less than 2. Once you hit 2 and over, we start calling it a viral pneumonia or something like that. So,
which is still serious, though.
Which can still be serious for sure.
Okay.
But they tolerate it better. So for kids less than 2, if they have a fever, if they have runny nose, congestion, cough, and they just sound a little junky, they have bronchiolitis. But if they're doing well, they're not working hard to breathe, you don't see their ribs when they're breathing, they're not breathing super fast. So I always tell parents, if they're breathing once every second or faster or, anywhere close to that, or you see their ribs when they're breathing, you need to go get them checked out. As long as they're drinking and staying hydrated, peeing multiple times a day, their wet diapers may not be quite as wet, but as long as they're having wet diapers and they're doing fine from that standpoint, actually taking them in could expose them and can expose other people. That as long as they're doing well at home, just like your grandma would keep you at home and watch you, there's not necessarily anything to do for it. If they're breathing that fast, where they're breathing once every second, or you see their ribs when they're breathing, they're not drinking, they're not peeing as well, they're not peeing at least 3 times a day, those are the times to call your pediatrician to get in. And then other times to go to your pediatrician would be if they have so much snot coming out of their nose or you can't really get it out. You can get better education from your pediatrician on how to suction them out. There's actually a lot of suction devices that are available over the counter now. I hesitate to say specific names on a
Sure.
podcast, but there's a bunch of infant suctioning devices that you can use. There's a bulb suction that we all get when we go home from
become
the
a
nursery.
parent. Yeah.
Yep. And then there's battery operated ones, other ones that actually work really, really well. And honestly, when you get admitted to the hospital, if you're not needing oxygen, or IV fluids, we're just suctioning you out and watching you. So you can do a lot of that at home.
This may be a weird question, talking about sucking out all of that gunk that you have. Can it help in removing some of the virus that gets into you? Isn't that what your body's doing, is creating that to expel it?
Your body's producing that as a response to the inflammation and to the virus. It doesn't really remove the virus at all. The virus just has to run its course and
once it's in you, it's in you. That's the thing.
Right.
You've just got to manage it that way. Obviously, when we hit this time of year, and like you had mentioned last year, kind of the first time that we were without the masks and everything, that it gets to be pretty challenging for a lot of doctors and healthcare providers when their kids get sick like this, right? Can you talk a little bit about managing cases of that and other respiratory illnesses, like concurrently when this is going on?
Yeah. So I think one of the biggest things is, just like with every other industry, the medical industry is, hit hard from the workforce. And so there's a nursing shortage, there's a respiratory therapist shortage nationwide. And I think we are better staffed than a lot of other places that I've been or know of. And so we don't have quite as much of a staff shortage as others, but we also obviously just have a certain number of beds. And so once we reach that number of beds, trying to figure out how we can still take care of other kids. And so that was really what happened last year, was between a staffing shortage and being able to safely staff a certain number of beds just across the country. Some kids were having to leave their town. Even kids in Denver weren't being able to be admitted to the big children's hospitals in Denver, and were having to go out to other areas that actually had bed availability. And so that's one of the challenges. I think the other big thing, though, is we've learned and just been reiterated, we need to obviously staff up as much as possible. But we've really learned over the last few years that we have had these new devices come out over the last 5 to 10 years that we call a heated high flow nasal cannula. And so we can provide oxygen at a higher flow, and we don't have to intubate or put in a breathing tube to these kids nearly as much as we used to. But we were weaning it really slowly, taking a long time to get off of it and those kinds of things. And we've really realized over the last year or so that we can just peel that off as fast as we put it on. And most of the kids do well with it. And we can shorten the amount of time they need to be in the hospital and kind of get them out faster and get them back home faster.
So as parents that have these small children that are susceptible to this, then, I mean, the first line of defense is prevention,
right?
Obviously. So what do you recommend to parents? Because like you said, you don't take them in for every sniffle, because that could expose them to kids that are there that's sick, and then you're going to take it home with you anyway. But what do you do? How do you even begin to kind of help yourself out with this, the triple threat that's coming up?
So it turns out hand washing is really good.
But getting kids to wash their hands, oh my God, that can be tricky.
Right, exactly. So hand washing is really good. I kind of have a love-hate relationship with a hand sanitizer, because I think while it's good, it also kills all of the germs. And so if your kids don't get exposed to germs, then we run into these things as well, where when they finally do get exposed to it, they're sicker than they could have been.
Yeah, their body just has no idea. Yeah.
Right. So just good basic hand washing is good, especially with caregivers. The holidays are coming up. And so just making sure that there's no one that's really sick that's there that you're letting handle, especially your really young infants. Social distancing, while I think we just feel like it was a term that was just created, it's really kind of been a thing we should be doing for a long time.
You know what I like, though? I have seen in various places just kind of around town, saw it just at the food trucks down here recently. I drove by and I noticed, oh my God, all these people are about 6 feet apart. and they're doing it unintentionally, I think, at this point, which I think is going to work out for us, maybe.
Yes, I definitely think it'll help. I'm from the South, and so I love my personal space.
Yes, exactly.
When I lived in New York City and was on the subway, I had to get used to no personal space. So last year, or the last few years, I was like, yes, 6 feet of personal space. Yeah. It's kind of gone away.
That
but
bubble's nice. Yeah.
That's right. Big bubble. Making sure that if you are letting anyone hold your kid, that they've washed their hand, use hand sanitizer, whatever. And just, being wise about where you take your kids.
Yeah.
Do you need to go there? Do you not need to go there? Does all of your kids need to go? We have 5 kids at home. And so it's like, do we need to take everyone to this, or just go like, what do we need to do as a family to try to keep kids as healthy as possible?
Well, I know some parents will even say, but you want to throw your kids out there, like you said, to get sick, to get the germs, to get your body used to it. And I suppose, is there any merit to that at all?
Absolutely.
Okay.
So it turns out that kids that go to daycare before they start kindergarten typically get all of their viruses exposed, and they are sick at least the first year that they're in daycare. The family is always like, oh my gosh, my kid is always sick. They are. They just keep getting virus after virus after virus. But when they go to kindergarten that first year, they're going to be exposed to most of the viruses, and so they actually won't miss nearly as much school as those other kids that weren't exposed and didn't get the viruses prior to kindergarten. And then now that they're in public school and around all of the other petri dishes that I call them, now they get sick all of the time, and they're missing kindergarten that first year. So there is a benefit to getting your kids exposed, but especially your kids that are less than a month old, that if they get a fever, it's super scary and you have to worry about all other bad things happening. Just being thoughtful of the age of your kid, how susceptible they are, the importance of the event, and all of those kinds of things.
So when do you kind of grow out of that? I think you might have touched on this too, that bronchiolitis stage. When does that kind of transition into, well, now you're just going to get bronchitis maybe?
The first 6 months, you're kind of at a higher risk of being really sick, and especially the first 3 months for sure. Bronchiolitis is a diagnosis up till 2. And so once you cross over 2 years old, then we think about viral pneumonias and stuff. And then you're kind of older school-age children to adolescents, preteens, they can start getting that bronchitis.
Okay. Well, there was one more question on here that talked about kind of in your experience, what are some of the key lessons or maybe best practices that healthcare professionals have learned in managing this case during this triple pandemic, and how do these insights benefit the healthcare providers and the rest of us?
I think, again, just making sure that we continue to staff up for it and kind of be aware of what viruses are out that time of year and everything. And then keep going back to, do we still need to do what we've been doing? So again, with that heated high flow nasal cannula thing of, always asking the question, can we wean something faster? Do we actually need this? Is it providing benefit, or is it just making the patient look better? And can we peel it off faster or go slower? What do we need to do from a medical care provider to try to keep the kids as safe as possible, get them well enough to go home as soon as possible, so that the family can be reunited at home and get back together at home? Because everyone wants to go to the hospital to get better, but that's not really what happens, right? You don't get the rest and everything that you need, even with kids. And so keeping people at home and giving them that time to rest and recover and be with their family, and get all of those extra snuggles and all that kind of stuff is really what's needed. So,
are we ever going to beat the virus, Doctor? Is it always going to be one step ahead of us, or will we ever finally? I don't know. I mean, that's a hard question to answer, really. But we've heard about it our whole lives, about viruses and bacteria, and it's like, well, why can't we just end it at this point? But I suppose it plays a role, right? In some degree, maybe. I don't know.
I don't think we're ever going to get past it. There's a new monoclonal antibody that's out that just got approved this summer for kids against RSV, but if you should talk to your pediatrician or your primary care provider to see if it's something that they agree with and it's something that they want you to get. But when it's not RSV, it's going to be adenovirus and it's going to be rhinovirus, and another virus will just come up and take over more than others. So
I suppose as long as we're just in these meat bodies, that's what's going to happen, I guess.
Yeah, exactly.
Well, Dr. Kyle Lemley, pediatric critical care specialist and pediatrician at Monument Health Rapid City, thank you again for coming in and talking with us. I appreciate it. You can come back anytime.
Thank you so much.
You bet. Thanks.